Hi everyone, I'm Judy Zhong and I'm a rising sophomore at Duke studying health economics. And this summer I worked with Matthew Maciejewski on a project called The Relationship Between Antidepressants and Bariatric Surgery Outcomes, a literature review. So first I'm going to provide a brief introduction and provide some context for the literature review I did this summer. Obesity is a rising and complex public health crisis. In 2016, 39.8% of US adults were considered obese. And bariatric surgery, also referred to as BS, is a type of weight loss surgery that results in sustained weight loss. So it's becoming increasingly popular to treat obese patients because it results in sustained weight loss and the reduction of key comorbidities. But in this population of obese patients, there's also a high incidence of psychiatric comorbidities, especially in veterans. So a large research project that we have is called the Long-Term Mental Health Outcomes of Bariatric Surgery. It's comparing long-term mental health outcomes such as alcohol use and antidepressant usage, and et cetera, and other factors of veterans who did and did not receive bariatric surgery in 2000 to 2016. And the current question we're looking at is, how does post-surgical weight loss differ by antidepressant class used by veterans before surgery? So the main objective for me was to develop a narrative review of the literature to inform the current long-term mental health outcome study about the different antidepressant classes. And this was broken down into 3 focus areas. So focus area 1 was on the impact of preoperative antidepressant usage on postoperative weight change. Focus area 2 was on the effect of surgery on postoperative antidepressant usage. And focus area 3 was on the pharmacokinetic effects of surgery. So all these 3 focus areas fed into the literature review, which then fed into the larger those study. So this is just a brief overview of the review process that we used. It's like any standard narrative review where we did a PubMed search using mesh terms, and then from the articles we identified using the mesh terms, we looked at similar articles and cited by articles. And once we found articles that were kind of relevant to our topic, we skimmed the abstracts and papers, determined if they were actually relevant, and then extracted certain data elements which are listed below, and then categorized the papers based on the different focus areas. So as for results, I'm only going to talk about the first focus area, which was about weight change, because that's the primary focus area that feeds into this larger study that we're looking at. And in total, we looked at 10 empirical studies and 5 commentaries, but for this focus area, there were 7 papers in total. So if we look at the top graph on the right, it has the percent total weight loss from 3 different papers. The treatment group is the group of patients that was using antidepressants, and the control group is a group of patients who underwent surgery who did not use antidepressants. And if we look at the percent total weight loss, there's no really significant difference between the two groups, which suggests that antidepressant usage doesn't have a significant effect on weight loss post-operatively. However, a paper by Plake in Plake 2019 used a different measurement. They used the measurement excess BMI loss, and using that measurement, they concluded that continuous antidepressant use was actually associated with reduced weight loss. And if we look at the bottom graph on the right, this is broken down by the different classes of antidepressants, and the one on the left is measured by excess BMI loss in Plake 2019, and the one on the right is looking at percent total weight loss in Hawkins. So for the group on the left, the blue bar is for the group of antidepressants called SNRIs, and as you can see, it resulted in a negative effect on excess BMI loss, which suggests that SNRIs has a negative effect on weight loss post-operatively, while for the group on the right, the Hawkins paper, which used measurement percent total weight loss, the blue bar for SNRIs, suggests there's a positive effect on weight loss, suggesting that these SNRIs actually increase weight loss post-operatively. So there's some tension there between the 2 different measurements used. In conclusion, there are some conflicting findings on the impact of antidepressants on weight loss post-operatively based on the different measurements that were used, and that it also suggested that certain antidepressant classes may affect weight change differently, as in the previous graph on the previous slides. As you can see, we can by grouping the different antidepressants by different classes, they have noticeably different effects. And the absorption of drugs also seemed to be greatly altered when we looked at focus area 2 and focus area 3. As for future directions, this literature review will inform the ongoing ELMO study about the different antidepressant classes. And this larger study may suggest that certain antidepressants are preferable post-operatively, meaning they could lead to more weight loss or sustained weight loss, and has the potential to guide better clinical practices for physicians who are conducting this surgery. So in conclusion, I would like to thank the following people on this slide, and I'm now open to any questions.
That's great. So any questions from the group?
Okay, this is Matt. I'll ask a question. If this is a bit of a hard question, but if you were to be able to design a trial to really answer this question about if if weight change after surgery differs by drug class, do you think it would make sense to recruit a bunch of people who are depressed and then randomize them to different antidepressants?
I think that would make sense, but we'd also have to measure for like depression post-operatively as well. Because based on the different studies that I looked at, they in conjunction with antidepressant usage, they would also include like a BCD score along with that, so we could correlate whether, because depression and weight change or like perception of weight is also closely correlated. So I think it would also be important to do that in this trial, in this study.